Hi, my name is Ben Scoll. I'm a urologist at Fore River Urology in South Portland, Maine. The purpose of this video is to go through some information about vasectomy so that you're prepared when you arrive for your consultation in our office. This video will review a few things: the technique of a vasectomy, what the risks are, and instructions. So the first thing you need to know is that vasectomy is permanent contraception. It's forever. Now, there's such a thing as a vasectomy reversal, but you wouldn't want to plan on one. They're very expensive, they're never covered by insurance plans, and they don't even always work. So how does a vasectomy work? Well, the testicles produce the sperm, and then sperm make their way up into the body through little transport tubes called the vas deferens. Those run up through the scrotum, in through the groin, and then back behind the bladder, where they run next to some little storage tanks called the seminal vesicles. The seminal vesicles store the fluid for your semen. So then, when a man ejaculates, it's the fluid from the seminal vesicles combining with the sperm from the vas deferens, and that mixture makes semen. Now, the goal of a vasectomy is to make it so you're ejaculating blank fluid, so fluid from the seminal vesicles, but no sperm in there. How do we achieve that? Well, it's pretty simple. We block transport from the testicles to the inside of the body so that sperm don't join the mixture. The way the procedure is done is you'll come into the office, you'll lie down on an exam table, and I'll inject numbing medication into the skin of your scrotum. Then I'll slide the needle next to the vas deferens on each side, and I'll numb those up as well. The numbing process just takes a minute or two. Then I'll make a little puncture wound in the middle of the scrotum. It's about this big, it's less than a centimeter. It's a puncture, not a cut. This is the so-called No-Scalpel technique for vasectomy. It's the modern way of doing it. It's less traumatic on the tissue. So then I'll bring out the vas deferens on one side through that little hole, and I'll do a few things to it. First, I'll put 2 clips on it. One on the low side, one on the high side. Then in between, I'll snip out a segment of the vas deferens and discard that. Then I'll burn the inner lumen, both sides. So there's a lot of redundancy. Clipping it twice, cutting out a piece, and burning it twice. We really don't want the vas deferens to reconnect. So then I'll drop that first vas deferens back in the scrotum, and I'll grab the one on the other side. And I'll do the exact same thing to the second vas deferens. Clip it, cut it, and burn it. Then I'll put a couple stitches in the skin, and you're done. So start to finish, the whole procedure takes about 15 or 20 minutes. You want to plan to be here in the office for maybe 45 minutes. Afterwards, you should expect to have a little bruising, some mild swelling, and some aches in the testicles. Those are all quite common. They can last a few days. Okay, let's go through some risks and then instructions. So the first risk is something called epididymitis. That's painful swelling of the testicles. It's fairly common. It happens in about 10% of men. The reason it occurs is that your testicles are going to be blocked off after the procedure by a clip. But the testicles don't know that, and they continue producing sperm. Those sperm can't go anywhere, so they back up into the testicles, and that causes pressure. And the pressure in the testicles can lead to pain in about 10% of men. This would be sort of an achy pain or a blue ball type of pain. It would typically show up, if it occurs in you, a few days after the procedure, and it could last up to 3 weeks. Now, it's generally fairly mild. Most men don't need pain medication for it, but some do. They take Tylenol or ibuprofen. And then what usually will happen is within a few weeks, the testicles will recognize that they're blocked off. So they slow down sperm production. The pressure dissipates and the pain goes away. So epididymitis is not a big deal over the long run, but over the short term, it is a pretty common annoyance. All right, another possible complication is a sperm granuloma. A sperm granuloma is what happens when some sperm get past the first clip. What happens then is your body sees those sperm that got through and it thinks they're foreign. So your body attacks them with an immune reaction to the sperm. And that leads to an area of inflammation right at the vasectomy site on the inside of the scrotum. Now this is less common. Maybe 2 or 3% of men will get a sperm granuloma. But if it happens in you, it's going to typically show up a few days after the procedure, sort of a tender nodule inside the scrotum. And that tenderness could last anywhere from a couple weeks to a couple months. Again, it's generally mild. Most men don't need pain medication, but some do. And then what eventually occurs is that the inflammation will calm down. So any tenderness there goes away. But then you would be left with scar tissue in that spot. It'd feel like a little marble inside your scrotum. It could be there forever. It's not really a big deal. Hematoma. Hematoma is a collection of blood in your scrotum. This is what happens if a little blood vessel starts bleeding after your procedure. Whole scrotum could fill up with blood. Obviously, that's bad. So to avoid it, I'm going to ask you to go home and lie down fairly flat after the procedure for 2.5 days. So let's say we did the procedure on a Friday. Then you'd lie down the rest of Friday and all Saturday and Sunday. Monday can go back to full activity without restriction. The reason I want you fairly flat is that if you're sitting upright, your heart's up here and your scrotum's down there, and there's all that gravity, and that can cause swelling and bleeding. Now it is in strict bed rest. You can get up and go to the bathroom. You can make a little food for yourself in the kitchen, minor things like that. But I want you to spend most of your day, like 95% of it, fairly flat. Think like a recliner. The men who listen to that, they usually do fine. The men who ignore the instructions, they go out and stack wood or mow the lawn, those are the men that swell up, and then they're swollen for a month. Or they bleed and they need surgery to get the blood evacuated. So obviously, that's worth avoiding. All right, another complication is an abscess. That's a pocket of pus in your scrotum. If that happens, I would have to drain that for you. Abscesses are rare. They occur about 1 in 500 men. We've done studies in our field to see if giving men preventative antibiotics at the time of the vasectomy would reduce the chances of an abscess afterwards. It turns out there is no benefit to the antibiotics, so we don't give them. All right, another very important thing to remember is that you will not be sterile immediately after the procedure. You still have sperm stored inside you. It typically takes about 15 ejaculations to clear those out. So, after the procedure, you're going to wait a few days and then you can start ejaculating again. You should use contraception with a partner. And then after a total of 15 ejaculations or more, you can go get a semen test at the lab. If that semen analysis shows that you're sterile, great. I'll let you know that you can stop using other forms of contraception. If you're not sterile yet, I'll ask you to do another 10 to 15 ejaculations and repeat the test. Now, 1 out of 1,000 men just will not get sterile after his vasectomy, despite multiple repeat tests. And the reason for this is that even though we clipped and cut and burned the vas deferens, somehow the thing reconnects. It forms some new channels. If that occurs, you would need to get a repeat vasectomy. Even more rarely, and worse, a man gets a semen analysis and it shows that he's sterile. And then somehow, months or even years later, the thing reconnects late. So the guy goes from sterilized back to fertile again. And you can have a miracle baby. So that's very rare. That's 1 in 2,000 or less. But it can happen. So you just have to be aware of that possibility. Now, vasectomy is the most effective form of contraception that we have. It's more effective than the pill. It's more effective than condoms. It's more effective than intrauterine devices for women. It's even more effective than a woman getting a tubal ligation, her tubes tied. It's just not perfect. All right, the final risk is chronic pain. That's typically men who are tender on the exam. In my experience, I'll examine you when you come into the office. If you don't have tenderness, I think your odds of chronic pain will be quite low, and we can discuss that. So that's it for risks. Let's go through some instructions. So the first thing you need to know is that 7 days prior to the procedure, I would like you to stop any pain medications that thin the blood. So these are things like aspirin, ibuprofen, Motrin, naproxen, those types of drugs. Tylenol's fine if you need to take something in the 7 days prior to the procedure. We will contact your insurance company to find out what this is going to cost. Every plan's different, so we will track that down for you. We'll let you know. It's important that the day before your vasectomy, you shave your scrotum. The best way to do this is with a razor in the shower with soap and water. Doing it with electric clippers leads to a lot of scuffing and should be avoided. The day of the vasectomy, you're going to go ahead and take your normal medication, although we'll discuss that when I see you in the office. You can eat and drink normally on the day of the vasectomy. There's no reason to fast for this. Have your breakfast, drink your coffee. Bring in some tight-fitting underwear. A tight pair of briefs or compression shorts will do the trick. that will hold pressure on your testicles for the ride home, and it reduces the risk of bleeding. You're welcome to bring in earbuds or headphones if you'd like to listen to music to mellow out during the procedure. And then as far as people are nervous or uncomfortable with needles, I can offer them Valium or a similar drug to take the edge off. That would be prescribed through your pharmacy. Or we can also offer nitrous oxide, which is laughing gas, and we can discuss that at your appointment. So if you have any questions, please bring them in with you, and I look forward to meeting you.